is Wesley Turner, and today I'm going to talk to you about the vaccinations of kids in appropriate ages and the benefits and risks that they all have. Your child has whooping cough. It is not something you want to hear as a parent. This has been a recent increase of diagnoses since the vaccinations have recently came out. Until then, we have actually seen a very large decrease in the number of these diagnoses. I've been a nurse for over 8 years and practiced in very many different settings. I have worked with pediatrics in all different settings, whether it be long-term care or acute care, such as emergency room setting. I've worked with many different pediatricians, and they all agree that the use of vaccinations for appropriate ages is the number one way to protect your kids from preventable diseases. Today we're going to go over the different benefits of vaccinating your children. We're also going to go over the real risks involved with the vaccinations and the risks of not using the vaccinations among your own kids and other children. And then we're going to go over the links that has been brought up about autism and vaccinating your children. First, we'll go over the benefits of vaccination. The CDC still states that the number one way to prevent your kid from over 16 preventable diseases is childhood vaccination. Also, the American Academy of Pediatrics agrees with this and states that this would be the safest way to keep your child from deadly diseases such as measles and whooping cough. The CDC points out that there are many years of research and scientists have done many gathering and experiments to make sure that these are the safest possible drugs to hand out to your kids. The FDA also has to approve these vaccinations or they cannot be given out to any of the patients. The U.S. has actually a very low rate of preventable disease deaths, whereas the use of vaccinations have decreased these deaths. With this chart, it shows that since the use of vaccinations such as here, the whooping cough vaccination here, measles vaccinations here, the deaths per year have tremendously decreased. So overall, the benefits have been proven to us by many years of research. However, there are risks involved, and we'll speak about those. Such risks are minor ones such as redness at the site, irritation at the site, and some even develop soreness in those sites, and some minor illnesses such as upset stomachs. But overall, those are treated very easily and gone over the next day. The risks of anything like an anaphylaxis reaction are very rare, but can happen, but medical professionals are trained to treat these if they ever happen. There is also a risk of when you don't vaccinate your children, you're not only putting your child at risk for these deadly diseases, but you also put other people's children who are not of age for these vaccinations. So when your child develops whooping cough and you have a family friend that has a young child who's not the age of vaccination, and they could actually develop that disease too, and at a younger age, it is very much more difficult for this child to fight this illness. Lastly, we're going to go over the links of autism and vaccinations. People have studied and found out that autism may actually develop before the child is even born, and many of these symptoms may come out before the developmental delays have actually shown to be in nature of the child anyways. Dr. Andrew Wakefield was one of the big leaders in the awakening of the autism link of vaccinations, but he has since lost his medical license. He was actually practicing on children with no pediatric experience, doing unethical studies because he used small groups of children and did not have the hospital's permissions to do these. So overall, there is no link between vaccinations and autism. So while there are risks, the benefits highly outweigh the risks of them. So I urge you to do your own research and make sure that you choose the safest choice possible for your children. Thank you.